Hey guys, and welcome back to my channel. My name is Lily and I am a registered nurse working here in the UK. In this channel I talk a lot about nurses because I am a nurse, excuse me, and also about how anyone can come into the UK to study, to live or to work. To all my returning subscribers, thank you so much for joining me again today. And if you are here for the first time today, thank you for joining me and you are welcome to my channel. In today's topic, I'll be talking about the Preceptorship program, and this is very exciting because my job title in the trust where I work is the Preceptorship lead. Yes, that is why today's topic is personal to me. And the Preceptorship program, the reason I'm talking about it today is because we have a high number of internationally qualified nurses coming into the UK to work. And of course, the Preceptorship program is something that all newly qualified professionals, whether home trained or abroad trained, will benefit hugely from. But I want my brothers and sisters coming from outside of the UK joining the NMC to understand the importance of the Preceptorship program and to be engaged in this program from the time they get their PIN. Please stay tuned. I'll be right back. So what is Preceptorship program? The Preceptorship program is a period that allows newly qualified nurses, nurse associates, AHPs, midwives to smoothly transition from being a student to being a qualified professional. Research have found that most newly qualified professionals within the NHS, they leave their profession within 1 year post-qualifying, and this is why we have a high attrition rate of qualified professionals leaving the NHS, all right? And what the Preceptorship program tries to do is to provide this smooth transition, provide strategies, provide structured support for all newly qualified professionals wherever it is they work, to kind of help them to navigate life post-qualifying. Because it's true that at the time you qualify and obtain your PIN, you are a knowledgeable practitioner. But that does not mean that you will be devoid of support. You know, people will just hands off you and say, there you go, they're your patient, look after them. This program is endorsed by the NMC and the Hcpc. You remember I mentioned that the program is also being offered to AHPs, which is the Allied Health Professionals. They are not regulated by the NMC, they are regulated by the Hcpc, which is the Health and Care Professions Council. And in the trust where I work, the Preceptorship program is offered as an inter-professional program. You may also find that in different hospitals, the AHPs will have their own separate Preceptorship program. It doesn't really matter if it is done together with nurses or if the AHPs have their own sort of different Preceptorship program. What matters is that at the end of the day, newly qualified professionals are being supported to transition into their roles. And when it comes to the midwives, the midwifery program is different from the normal Preceptorship program of nurses and AHPs, in the sense that at the end of the Preceptorship program for midwives, they come out to become band 6 professionals, and this is because their own program is tied to some clinical skills they have to become competent at, things like suturing episiotomy, independently carrying out deliveries, and all other midwifery based knowledges that they have to be very good at before their first 12 months post qualifying is over. So at the end of their program they become band 6 professionals, whereas in the normal Preceptorship program for nurses and other AHPs, when they want to become band 6, it's something they're going to have to apply to because they feel ready, they feel competent enough to do so. It does not just come to them at the end of the Preceptorship program. Now, when it comes to our internationally qualified nurses, we also offer the Preceptorship program with them. Now, mind you, some of the overseas trained nurses are coming in with a wealth of experiences. Some of them have got 10 years nursing experience, some have got 5 years experience, some are completely newly qualified. But it doesn't matter at what stage of nursing practice you are in, we offer the Preceptorship program to one and all. Now, we try to kind of introduce what we will call a bespoke Preceptorship program to the nurses that are coming from outside of the UK, who may have had a lot of experiences in leadership, in charging duties on the ward, to see if they would find the Preceptorship program, you know, useful, because you don't want to offer the same program designed for people that are newly qualified to someone who's got a wealth of experience. But what I am finding in my area of work is that even though they have got 10 years of experience, they still really want to go through the Preceptorship program, and I'll tell you why. The reason being that they are now in a new environment. Okay, these nurses have come from a place where Nursing care is still the same at its very core, but the way things are done, the way the hierarchical structure is set up is completely different from where they are coming from. For instance, I trained in Nigeria, okay? Preceptorship program is nothing that I've ever heard before I came into the UK. And the way the hierarchy of nursing is structured is a way that you don't call your senior sisters on the ward by name. You have to call them by sister or this or that. Whereas here in the UK, people want you to address them by their name. The hierarchy is not tied to who they are as a person. In fact, I was corrected over and over again by my manager when I first joined the NHS. Lily, please don't call me sister. Lily, please don't call me this. Lily, please don't call me that. My name is so and so. Call me by my name. And do you know what? It's a lot of unlearning. Understanding that I've now come into a new environment, that things are done differently. If I feel offended by a senior member of staff, I feel empowered to actually challenge that in a respectful manner. You know, I also know people that I can go to and share my concerns with, and I'm very, very much aware that whatever comes out of that concern, I'll be kept in the know. And if you come into a place like this and you don't undergo the preceptorship program, you don't really fully integrate into working in a new establishment. You don't understand the hospital policies. You don't understand what you can be able to achieve. And if you are a kind of person that loves to really develop yourself, coming to the preceptorship program opens up that window for you, so you know who you can speak to if you want to kind of go back to the university to do any program, how you can shadow other nursing specialists if you want to become like a diabetic nurse or you want to become a stroke nurse. So it's not like if you don't attend preceptorship program, you won't still access all of this. But being in that group does something to your side, kind of prepares you for the life and the career of what really nursing in the UK is all about. So I'm going to use this medium as an opportunity to pitch the preceptorship program to all of our international nurses coming into the UK. If the hospital where you are working does not offer preceptorship program, or you are not aware that you should be attending a preceptorship program, please, after watching this video today, speak to your ward manager. If it is something that is being offered in your trust, I'm very sure that they'll be happy for you to join in the program. Now, let's talk about how to get enrolled in the preceptorship program. Now, as a newly qualified professional, most trusts within the UK would offer you preceptorship program as soon as you join the trust. And I've never known anyone who turns down the preceptorship program, because what's not to love about it? There is so much to be gained from the program. So if you do join any trust and you have no idea that you should be attending a preceptorship program, like I've said before, please reach out to your ward manager and find out where they stand when it comes to preceptorship program. Once you are enrolled into the program and you have access to your dates, my advice would be for you to go to your rota and request all of those days as study leave. As you know, the NHS is still undergoing a massive staff shortage. So if you are then a newly qualified person, we need you to attend the preceptorship program. And for you to support that plan, you also have to be proactive in requesting those dates on your rota to give you the maximum chance of attending the program. Now, let's talk about what is covered during the preceptorship program. The topics that are covered in the program may differ again from trust to trust. Where I work, we run 6 different classroom sessions. On the first day, we talk about introduction to preceptorship program. We talk about what the program is really all about, what you stand to gain from it, what you are expected to do now that you are a newly qualified professional. So we establish that relationship, establish a safe space where you can talk about your challenges, where you can talk about your experiences. Because when you come in every class, there are always people who are not vocal, and it's not a fault of theirs, it's just the way they are, and that's absolutely fine. And you also have people that are really vocal, that are happy to share their experiences. So preceptorship program is a place where even if you're not contributing anything, you can learn from other people who are willing to share their experiences, and you can know that actually you're not alone or you're not doing very badly at all. Another topic we cover is making the transition from being a student to being a qualified professional. So you will find that at the time you have gotten your PIN, you're no longer a student, you are a qualified professional. So in your own right, you are an autonomous practitioner. So you are giving your own patients, you no longer have anyone hovering behind you, you no longer have anyone signing anything you do. You are completely responsible for the care that you give to your patients. And this is where it becomes really, really important for you to know what your scope of competencies are. All right. So when you attend this program, we remind you over and over again that the fact that you are a newly qualified professional, the fact that you've got your PIN, the fact that you're completely responsible for the care of your patients does not mean that you should be doing things that you do not understand. If there are areas of practice that you still need further growth and development on, you shouldn't be doing those things unsupervised. So in the preceptorship program as well, when we talk about making the transition, we also go again through the codes of conduct, how it comes to play as you look after your patients. And again, another topic we cover would be working as part of a wider team. So interprofessional collaboration between yourself as a nurse, or you as a nurse associate, or you as a AHP with other members of staff. Because as a person, you are not able to provide all the care that your patient need. You are at some point, you will rely on the doctors, you will rely on the physios, you will rely on the theater personnel to look after your patient, because you can't surgically operate on a patient, but you can check their observations, you can do their wound dressings, you can give them medications. So understanding your role as part of a wider team helps you to appreciate every other person that works in the hospital and know who you can reach out to should you need to care more for your patient. And then another topic we cover is something like mental health awareness, where you not only learn how to look after your own self, but also to identify mental health challenges in your patient. We also cover deteriorating patient, how you can identify deteriorating patients. Now, this is a topic that cuts across. It doesn't matter if you are a physiotherapist, it doesn't matter if you're a nurse associate, we are looking after poorly patients. So at some point in time, they may be really poorly, and if you are armed with the knowledge of understanding your ABCDE of how to identify very poorly patients, this would really come in handy to make sure that you escalate the concerns quickly and your patient can get help as soon as they need to. The last topic we go through would be that on leadership, where at this point we kind of agree that you've gotten to the point where, yes, you now know what you're doing in your practice, because at the time we're running the leadership program, you're getting nearer to being 12 months qualified, or even more than that if you didn't start at the time you qualified. So this is the time when you started thinking about, am I going to apply for a band 6? We talk a lot about how you as a person, how what you value kind of determines the kind of leader you are going to be, how you can use your values to influence your behavior, so that when other people around you are asked to kind of identify you as a person, it is your values that they are going to identify. All right, so leadership is not just about autocratic leadership, transformational leadership, bureaucratic leadership, and all of that. No, it's about you as a person, what you value, how your value influences your behavior, and how other people perceive you as a person. And also talk about how you are then going to apply this in case you find yourself in the leadership position. So how long does the preceptorship program last? The preceptorship program is designed to last for at least 6 months. Now, we have what we call National Preceptorship Framework. And what this states is that any trust can achieve either a gold standard or a core standard. For any trust to achieve core standard for preceptorship program, they need to run the preceptorship program for at least 6 months. And to be able to achieve a gold standard, you should be running this program for at least 12 months. If you are running your preceptorship program for longer, for 12 months, it means that your preceptees attending the program is getting more and more support. They are still within your radar. You just don't hands off them at the end of the 6 months because, yay, they've just gone through the preceptorship program, off you go into the ward and look after your patients. No. But if we run it for longer period, it means that we are staying in touch with our newly qualified professionals even longer than 6 months, keeping in touch and finding out how they are getting on in their practice. Now, let's talk about the terms that you will come across during the preceptorship program. So you will hear things like a preceptee, which I have used, regularly in this video. So a preceptee will be you who will be attending the preceptorship program. So another term is the preceptor, and the preceptor is someone who have got more than 12 months qualified. Okay, and if you're a nurse, your preceptor can be a nurse as well. If you are a nurse associate, your preceptor can be either a nurse associate or also a nurse. And if you're an AHP like dietitian, occupational therapist, physiotherapist, ODP, you also find someone within your immediate working environment who can be your preceptor. It's also good to get someone who you work the same kind of shift pattern with, so that there will always be more chances of finding time to have your meetings with this person to see how your practice is developing. Another thing you would find mentioned all the time during your preceptorship program would be a preceptorship portfolio. And as much as this looks like a competency pack, I assure you it is not a competency pack. What is contained in the preceptorship portfolio is a brief introduction to preceptorship program. We attach things to the portfolio that mimics what you would need for your revalidation. Remember that you will need to write some reflective forms for your revalidation. You need to write some feedback. You need a certain number of hours of practice to be able to revalidate safely. And we put all of these information on how to help you revalidate either with the NMC or with the Hcpc. Now let's talk about the benefits of preceptorship program. One of the best benefits of preceptorship program is that it's an avenue for networking. So you're sitting in a class where you are joined by other people on the same journey with you, okay? Because it's so easy for you to sit and beat yourself up and say, I don't know how to do this, I'm really slow, I don't understand this, I should be knowing how to do this, but I don't. But sitting in that class and watching other people share their experiences, you will kind of know that what you see as a concern is shared by one and all, and it's important for you to give yourself the grace of actually transferring your knowledge into practice, and you need to repeat those practice over and over again for you to earn or learn mastery over them, for you to get to the point where you become really confident at doing the things by yourself. No one starts as a new person in any area being a guru in all that they are doing. You have to go through that uncomfortable phase of learning. Another benefit to this program is that you feel less isolated. Remember that I mentioned earlier that newly qualified professionals are seen to leave their profession within few months post qualifying, and this is because they feel like the transition from being a student to being a qualified professional is quite overwhelming for them, or that they are not receiving the kind of support that they thought they would when they start work. So preceptorship program comes with a pastoral support, and what the pastoral support means is that you will get a hands-on support from the preceptorship lead. In my trust, I visit the wards to see where my preceptees are working and see how they're getting on, and if there's anything I can support them with, I do all of that. If there are things they don't understand, I explain as much as I can, and if there are trainings that they need to do that they have not been able to attend, I find out if there is any way I can expedite those trainings so that they can do them and increase their confidence in carrying out their role. And again, it helps you to understand that asking for help is normal. In fact, asking for help should be embraced. It's not a sign of weakness. It's actually all right for you to look at a task assigned to you and say, I don't know how to do this. I can't even tell you how many times when I newly joined the NHS, I will hide in the toilets or watch some procedures on YouTube to see how I can do it, or have to go back again to ask someone over and over because I'm yet to understand. And there are people that will just leave the trust because they get tired of asking questions. So when you attend the program, we kind of try to make you understand that it's all right for you to ask for help as many times as you require. We all will transition very, very differently. So the fact that it may be taking you longer to do something does not make you slow at all. It just means that you need to give yourself more time to learn what you need to learn. Another benefit is that you would be exposed to your CPDs. Remember, if you are working in the healthcare industry, you have to be a lifelong learner. We have to keep continuously updating our knowledge. What you know today may not be relevant tomorrow. So CPDs are important. In fact, the NMC demands that you show proof that you have continued learning even after you qualify. So coming to the preceptorship program is a way that you can keep up with this learning. So if you have watched this video to this point, thank you so much for joining me today. I hope that you have found the information in this video today useful. If you do have anyone joining the NMC from outside of the UK, please share this video to them so that they can understand how the preceptorship program can help them fully integrate themselves as a UK-based nurse. So thank you once again for watching, and I hope to see you again in my next video. Take care of yourself now. Bye.